COVID-19 continues to be a top priority, but officials want to make sure the flu is not forgotten about. Thanks for joining us. I'm Brad Hansen.
And I'm Catherine Halverson. News 9's Isaac Dinesen has a look at how the state has been handling the flu and what you can do to fight it.
Unlike COVID-19, individual cases of the flu aren't as easy to get an exact number on or track, but officials know right now that it's a good time to prepare.
But we're starting to see an uptick.
At hospitals like Aspirus, COVID-19 cases are still a focal point. But flu cases have been creeping into Wisconsin slowly but surely.
It's that patient that comes in and says, I've been feeling great, and all of a sudden I woke up and felt like I got hit by a truck.
Recently, the DHS is reporting more than 120 people have contracted the flu virus, about 3 times as many as last year's entire flu season.
I'm sure that there is more out there of people who kind of just deal with it at home, especially in the COVID world. People aren't wanting to come out in public.
The winter months are when the flu is most easily spread, and it can have a greater effect in children.
The children are more vulnerable to get sick from the flu. You're seeing classrooms of kids being sent home because of the flu. That remains to be true.
Last year, there were 3 pediatric patients that unfortunately died from influenza. And so kind of taking it really seriously, especially in our young children, is really important.
Officials are saying slowing the spread of the flu is just like slowing the spread of COVID-19. Washing hands, covering coughs, and getting vaccinated.
The flu shot won't necessarily prevent you from getting the flu fully, but it'll prevent it from getting so severe that you might end up in the hospital with it.
Getting it now is a good idea before the brunt of winter hits.
As of late November, just 30% of Wisconsin residents have received a flu shot. In the newsroom, Isaac Dinesen, News 9 WAOW.
Thanks, Isaac.